photo here. Once you understand this, we are done with my topic. If this small water, which I described, is called the aqueous humor. If there's any blockade in the pathway, you realize that there will be backup pressure. Just compare that to the faucet and our sink. When you open the faucet, we'll be a pipe now. You see the water will be flowing. But while the water keeps on flowing, there's a hole here, which is the drain. The drain is just like the trabecular mesh that I was talking about. That is supposed to absorb water and drain away. But if there's any problem or if there's any damage to the trabecular meshwork, of course, there will be buildup of water. In Tinsono, Tokune Ohono, Ubi pipe ne Ipsia. We know air kunyina not say you can see say in Suno Thermo because and Imuna day see. Nemusia, look at this picture, this small picture. You can see that there's a huge backup pressure pressing on the eye, and most importantly, the optic nerve. And this damages it. Explaining glaucoma could be very complicated. But again, just to let you guys know that the normal eye pressure basically ranges probably from 16 to 22, but we have various variation of blood pressure. In fact, it's been shown that any person that has a pressure above 21 millimeters of mercury is considered high, and that can cause problems. But again, this does not include or diagnose or exclude the glaucoma. That is one thing I want you to understand. This is how we understand this, how most glaucoma comes about. But again, whether high or low, you might have, which I'm going to describe very soon, you might have a normal pressure glaucoma. So again, this is another diagram just to explain what I've said so far. We have the optic nerve here, basically to transmit the information to your brain to interpret, for you to see clearly. If this eye or this nerve is damaged, of course, there will be no transmission, and that will lead to problems, in essence, glaucoma. So it's a progressive glaucoma basically progressively injures your retinal ganglion cell, basically your optic nerve. And the end goal or the end problem is that you have a total blindness. Look at this image. Again, we are trying to explain what glaucoma is because it's a very complex disease. Look at these two images. You can really see that there's one that is very, bright. We call this one capping. This one may be near Libunubino. The next in a shit. This guy has lost his optic nerve. That's because gradually it kept on eating to the extent that it developed increased capping, and the capping is just eating away of your nerve. So the central depression of your optic nerve becomes larger and larger until the nerve tissue is gone. This one will be the healthy one. So you can see this is a very healthy optic nerve. And this guy will be seen clearly. So there's a damage of your optic nerve. There's a loss of these important retinal nerve fibers, and that produces that characteristic optic disc. Of course, I'm going to show you something about what we call the visual field. You end up losing your visual fields until finally you'll be having what we call the tunneling symptoms, and then probably your vision will be gone. So there are so many types of glaucoma. Just quickly, just to explain, we have the open angle glaucoma. You'll hear about the angle closure glaucoma. We have the normal tension glaucoma. We have certain glaucoma. We classify them as secondaries. Okay, just to mention for a few. So the open angle glaucoma is the most dangerous one and is the most common one. In fact, if you count 10 glaucoma cases, 9 of them will be open angle glaucoma. And that is what we have been describing so far. the drainage angle between the cornea and the iris is physically open. It's not closed, but the problem is the meshwork. You know, so I say the meshwork is damaged. So realize that the pressure may gradually rise and lead to optic nerve damage. So normally it's very slow. It affects both eyes. It is painless. I didn't say, oh, a nerve, no. But it's painless. You don't experience any pain. You'll be walking, smiling, eating, enjoying life, but gradually eating out your optic nerve. There's no symptoms. In fact, you start losing your peripheral vision. Oh, I say, no more be me wisi. Then by the time we will go for evaluation, the nerve is gone. We have another one called the normal tension glaucoma. This one, as I said, when we check your eye pressure is normal. It has an open angle, nothing more, nothing less. The pressure is normal, nothing is going on. But research have shown that most likely some of us, our optic nerve, a sensitive pressure can be kind of penese. Inti mu bi wo ha, yeze bi a pressure was so, bibi kakra bi kind of penese. Highly very sensitive to pressure. Sometimes there's a reduced blood flow. You know, omo amota efia nkrom pa ding. Wow, strate minimum. And from a beer called the phone the entire 12 hours and as I say 8 hours what day when you're from a papa beer. It did ever pa for optic nerve no. You know, those of us having sleep problems, sleep apnea, you know, snoring loudly, they don't go for an evaluation to, you know, where we can treat them and take away this problem. They will have deprived oxygen to the tissue of the optic nerve and gradually damages the optic nerve. So the pressure may be normal, but because of this problems like this, you'll be basically leading to disease called glaucoma. There's another type called angle closure glaucoma. This one is an emergency. Okay, this one is an emergency. This one comes with pain. So this small part of the subtypes, glaucoma we need the idea is treated right away. The angle closure glaucoma no, it happens. It happens suddenly. Severe pain. You have very severe pain of your eye. Your eyes are red. You see there's a blurry vision. You see halos of light. You have headaches, nausea. Sometimes you'll be vomiting. Onya, busia opanyini. And it could be this problem. So please don't waste time. Go to the emergency room, call 911, and you'll be picked up. This is an emergency because it can lead to blindness. Because we know sudden blockade no is only ma enko na a day. One of the important things that we need to take note. Here take note. Ubi any ye ten rana na ye koko. We blurry vision. Menko ye bibia nko fit fat o twenso mo fa nko hospital right away. In treating. The other forms, as I said, may be secondary glaucoma, you know, develops because there's another condition. There might be an injury, like eye trauma, will be a shinasum, will be a shineniso, yes, or shineniso maneniso stars and kwa. So it could be an eye inflammation, it could be uveitis, infection, some of these problems can lead to damaging your optic nerve. And at the end of the result, you'll be developing glaucoma. And these are what we call the secondary glaucoma. So it's from a problem of BB. So BB na a day problem near a glaucoma never. So, but the most important thing I want to mention here is steroids medication. Steroids. You know, some people use steroids a lot. With little inflammation, they will go to over the counter and go and buy a steroid eye drop or something, then start taking steroids. Steroids are one of it's very helpful medication, no two ways about it, but be very careful because steroids can lead to secondary glaucoma. Yemani bi wo ho a ye wo mo se omo no omani so problem wo ho a glaucoma is we bitimi aye omo. In the no like congenital, we call it the congenital or childhood glaucoma. Normally they will have excessive tearing, sensitivity to light. There will be some cloudiness in their cornea, and they will have enlarged eyes. So who sakra the needs no, the need to know utim say a ye fita the be a pruso sa na utim say who na near a yade normal, you see it. Sakra the way. Don't hesitate. Please get evaluation by the pediatrician or the primary care provider. Then appropriate management and referral will be made. Don't hesitate on it. Now let's go to the meat. We will finish very soon so we can bring our questions. The question we want to answer is who is at risk? Who is at risk? Of course, any one of us, anybody, we can all develop glaucoma. But there are some people that have substantially greater risk. Of course, when you have elevated eye pressure. So when the pressure na when you know you stand at risk. See the mechanical near and you know a day adwene kwa adwene mo yete ehu ade no na se no. So basically the pressure within your eye damages your optic nerve and leads to glaucoma. Increasing age. See the at risk. When we are African American or you have any African American ancestry, you stand at risk. In fact, Black people are at higher risk of developing open angle glaucoma. Study shows. In fact, they develop at a very tender age, at a very young age, and most of them experiences severe vision loss. You know, people from Africa, Caribbean, Afro-Latino, you know, these communities, we are at risk. CDC reports that Black people are several times more likely to develop glaucoma than white people. So that's why we need to understand this problem and how to avoid it. Okay. So I saw this diagram and I find it very useful, especially for us, those of us who are in healthcare. So open is very simple. Your cap will be capping. Basically, your optic nerve will be capping, will be having wider dip because you are damaging your nerves. It will be becoming bigger and bigger and bigger. Progressively, you'll be losing your peripheral vision. There will be elevated intraocular pressure, and there's no pain. There's nothing. A chronic crown cross. Into when open now, the mnemonic just tells it out. And now close. That is an emergency. Close, there will be halos, there will be pain, there is a sudden onset. Of course, don't hesitate to go to the emergency room for evaluation. So, just to emphasize, please, a sudden severe eye pain, red eye, blurry vision, when you're normal, don't waste time because time is of essence. Time is of essence. So, go to the emergency room immediately for evaluation, and especially when you have other symptoms of headache and other stuff. I want a question. I want to ask this question: how glaucoma is diagnosed? Just think about it. So how does physicians arrive at making a diagnosis? There are so many ways we go about it anyway, but we start primarily from your history. We're looking at your family history. Again, I said, if you have somebody in your family, your grandfather, your father, your mom, who develop glaucoma, you are at risk. So you have to be careful. People who have been using steroids here and there frequently, just using them anyhow. Diabetics, people who have vascular problems. Anybody, on some medications, certain medication can lead to diseases like glaucoma. So just be careful, be aware of it. and of course, when you have all these visual symptoms. So we start from the history. Basically, we look at all these things to understand what is going on. We use this, so please don't miss. On Sabbath, we're going to use this Snellen chart to do the screening of our visual acuity. And basically, these are the familiar letter, E, F, T. But please, this is very useful in helping us to make diagnosis. But when you have a normal visual acuity, does not rule out glaucoma. Okay? So, oh, me ice cream on what I'm good. No. As I said, remember, glaucoma starts from the periphery. We'll say free. In Chemu, say, if you finish the audio and say you are okay, indeed, we have to be careful about it. Sometimes, we go ahead to measure your eye pressure, the intraocular pressure, using the tonometry. Into corner the way show near, you see, no pressure, not to say. So we use this to determine the pressure. They have so many types, the Goldman, applanation, tonometry, and other stuff. Of course, this is what I want to tell you. When they measure your pressure, don't count value. Don't when they tell you your eye pressure, I mean, you shouldn't be so much concerned because the pressure fluctuates. Okay, so most physicians, we need to establish your baseline. Sometimes even the cornea thickness affect interpretation. So there are so many things that can affect the interpretation and your eye pressure. And I'm very sure that your primary care, or maybe if you are being evaluated by an optometrist or ophthalmologist, they will let you understand whatever is going on. Sometimes we need to dilate your eyes. You open your eyes. As I said, look at the pictures here. The last one down here, all the nerves is gone. And we are going to do this screening on Sabbath. So please don't hesitate. You will not dilate your eye. You will try and see if we can look at the back of your eyes. There will be no dilatation of your pupil. But we'll try and see if we can look at the back of your eye. I remember at school when we were doing eye screen like this, there was a guy whose nerve was almost gone. Almost gone. He was lucky. And the guy was very young, almost like 20 years. So you can imagine, some of these things are life-saving. So please don't miss out on Sabbath screening. You look at your eye, and just to make sure that there's nothing that we are seeing that is concerning. Okay. We do all these things to help make the diagnosis of glaucoma. Sometimes we use the visual field testing. Patients will press on a button whenever they see light or see somebody's hand, and the test help us to map the periphery and the central visual sensitivity, and this will help us to characterize glaucoma and certain blind spot. Again, it requires concentration. Make sure that you do it well. Sometimes it was very unreliable, but probably we may have to repeat. This will be the optical coherence tomography. So I'm just trying to let you know so you don't be scared or you have some anxiety about. These are all machines and tools that will help us or help the clinicians to rule out glaucoma or make diagnosis of glaucoma. So the optic coherence tomography is they use light waves, and these are to create images and helps with various measurement. They can use it to measure your retinal thickness. It's a very fancy machine, optic nerve structures used to determine so many things. It's a painless process. It doesn't involve any radiation, nothing of that sort. And sometimes we go ahead to use the gonioscopy. So, these are all instruments that we use in making diagnosis of glaucoma. This special mirror help us to examine the drainage very well. Remember, I was talking about the drainage, the trabecular drainage meshwork. We can use it to visualize it very, very clearly. Okay, whether it's closed, whether it's open, and will help guide us in treating glaucoma. The treatment is very simple. Just this line. So what line we are here, that is all. The goal of treatment is to lower the eye pressure enough to prevent or slow additional optic nerve damage. That is what we are trying to work on. Until once we diagnose it, when you're glaucoma, no, the clinicians and also doctor, say progression ko. Na fe kakra with me use to say mmra nyankopon de bema wo. Enti idea ehu hia pa, you try say you be establish the starting pressure, and sometimes they will give you certain medications to help regulate your eye pressure. We will see how the rate of progression, you see your age, your life expectancy. You know, we combine all these factors in making decision. Sometimes they will prescribe some medications such as latonopros, which is a prostaglandin analog. Basically, it helps to improve your fluid outflow. Pipe no mercy. I was say we move be money there. Echo. As I illustrated, we're using the sink. The sink drainage is blocked, so we need to open it up. We use some of this medication to do that. Sometimes we need to close the tap, you know, by using maybe a beta blocker. The beta blocker will help us reduce the fluid production. But remember, when they are prescribing you any beta blocker like Timolol on the eye, please don't forget to tell your provider that, hey, I'm asthmatic, I have COPD, I have heart block, I have stents, I have this, I have cardiac abnormalities, because some of this medication can also affect your lungs and heart as well. You may use brimonidine and other stuff. As far as using so many fancy technologies like laser and surgery, I think it's now becoming the norm. Your operation, the laser be near to na afia mo bia mu kama na je say enso na ebam no emu asane kama. Now, the most important thing is say when we prescribe the medication, please don't hesitate to ask questions if you don't have if you have any. Number 2 is take your medications as prescribed and follow up with your primary doctor as scheduled. Please don't miss it, because it's very important. As we said, this disease is very slow, progresses slowly, keeps on eating away. But once we detect it earlier, we prevent all this progression and basically improve visions. It can be prevented, of course. Can we? The question is, not every case can be prevented, unfortunately. Because of their family history, their age, their anatomy, their family history. But the good news in it, early detection. Si ehun ntemu a ebu ha ufri so koba fam ayade dia wo no, but ehun ntemu a early detection saves life. Severe vision loss can be prevented and delayed if you detect it early. That is why it's important to have your regular comprehensive examination. Make sure that you adhere to your medications. You ask questions if you don't understand. Please, if you are coming to the office and you are on any medication, bring your medications to the office so that the doctor can see. Don't just describe them, because probably there might be some miscommunications there. Keep your follow-up appointment, and always remember to protect your eye from injury, because injury can cause secondary glaucoma. If you are diabetic, make sure you take your medications appropriately. Make sure that you take your blood pressure appropriately and your overall health. When you find any side effect, of course, when there's any confusion, as I said, please bring your bottle to your appointment for us to discuss it. Now, I am getting to the latter part of my presentation, healthy lifestyle. There can be no. In fact, it's your choice. It is my choice. You know, research has shown, say, many people, more exercise, regular exercise, having balanced diet, avoiding smoking. Smoking, remember, avoiding is not only smoking, secondary smokers. Those who be smelling like these are all radicals getting into your system. So please avoid that. Making sure that you manage your chronic disease. Making sure that you are aware of everything that you are putting in your mouth. Okay. These are things that can slowly prevent and basically prevent glaucoma. I've already talked about your physical activity. Make sure you balance your diet, avoid smoking. Make sure that you protect your eyes from any form of injury. Some people will be using vitamins to kill vitamin B. What's the vitamin B? No, we can't use vitamin to kill glaucoma. Unfortunately, waiting for symptoms or training, I don't know, say ansana or doctor. There be, but more than making sure say unregulated herbal eye drops. You don't know the medication. When you, oh yes, say I do good and this one, yeah, papa, in the cotton. In our culture, they will testify about medication. Oh, this guy was using this medication and it helped. So I'm going to use it. You don't know the content of it. They've not done any research. In fact, we don't know whether there's another ramification or any side effect of the medication. Then we'll be using it and causing all this problem. Please make sure that you avoid this. Please remember that in all things, as we move about, as we go on our daily activities, we produce something called oxidative stress through aging, through our lifestyle, through the environmental factors, things we are doing. God has given us special things. God has given you and me special diet, special food. Please, let all home back to Eden. Go back to Eden. They are full of antioxidants. Spinach, they say green vegetables. They reduce inflammation. Please, eat them, and let's avoid this meat and all these things. Oh yeah, glaucoma no Emma. No if you say you have reduced all this inflammation and your body is protecting you. God has given all these things. Please, let's make right choice when it comes to diet and eat good food. The anti-inflammatory food that will help to reduce all these oxidative stress and other stuff. Seek immediate attention, please. Seek immediate attention when there's problem. When you have a severe eye pain, when it's vision loss, when it's headache, please remember close angle glaucoma. It can lead to total blindness. So one person will say, oh, I see clearly. I can see clearly. Therefore, I don't need anything, please. No. Remember that glaucoma starts from the periphery. The central vision may remain normal in the early stages. So by the time you come to see the doctor, it's gone. The nerve is gone. So when there are any problems with your peripheral vision, don't hesitate. Seeing clearly does not rule out glaucoma. Oh, my eye pressure is normal when I went to check it. Remember, there is a normal tension glaucoma. Oh, when the doctor gave me this eye drop, it fixed it. Now everything, I'm okay. I don't see any problem. I don't see any halos. Please, the medication is treating, it's working, so don't stop it. Sometimes you'll be wearing glasses. Oh, these glasses is okay. Please, glasses do not repair your optic nerve. When the optic nerve starts to damage, it's gone. It's gone. We can't do it. Nobody can reverse it. It's gone. When there's no pain, does not mean there's no disease. Remember that open angle glaucoma is painless. Okay. So these guys, as African ancestry, above 80 years, above 60 years, you have family history, you are diabetic, you have trauma, you are using steroids, please make sure you make all this information known to your health professional for better examination and evaluation. So 5 things. Remember these 5. If Mekasa Egina want to be after all these lectures, please, if you didn't hear anything, these 5 things, remember. Number 1, glaucoma damages optic nerve. Or say, when you know no de ko adwene. Number 2, it's a hooding, a friend of silent killer, silent thief, or say hooding, you don't see this guy, yet he's damaging your optic nerve and taking away your sight. Number 3, pressure alone cannot confirm or exclude glaucoma. Okay, it's a syndrome, it's a big picture. There are so many things that can affect your optic nerve. Number 4, lost vision is usually permanent. Once your vision is lost, that is one, it's gone. We can't fix it. So, importantly, early detection and consistent treatment preserve sight. Not forgetting your lifestyle. And China use over Jesus is coming soon. Revelation chapter 1, verse 7. Look, he is coming with clouds, and every eye will see him, even those who pierce him. I did it for Jesus, by Jesus Christ, no family no. But see, who know? No, Jesus is calling you to make good choices for your body because your body belongs to God. I will end my presentation here. If anybody has any question or contribution, please, we have about 7 minutes. We can have our discussion. Thank you so much for your attention.
Thank you, Doug. God bless you. God bless you. Now the floor is open. Like Doctor said, we have